So how do we test antibiotics, whether or not they can inhibit the growth of microorganisms? So for this we employ two main categories of tests. One category allows you to determine what is called minimal inhibitory concentration. I'm going to call them MIC+. So these two tests are dilution methods and easy strip approach. So what do you do in dilution method? Very, very simple. You prepare broth with different dilutions of antibiotic. Does that make sense? You progressively reduce the amount of antibiotic that you have in your broth. Then you inoculate the broth with a microorganism of interest, and you see when the concentration of antibiotic becomes large enough so the microorganism stops growing. Basically, you can look at it like this. So if concentration of antibiotic, say milligrams per liter, goes like 1, 2, 4, 8, 16, okay? And whether or not there is growth, the microorganism, growth, 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 no growth. So the minimal inhibitory concentration will be, strictly speaking, it's not 8, it's somewhere between 8 and 4. And you can break it down even further and narrow down the range. Does that make sense? No? Yes? Blink once for yes, twice for no. Okay, good. Easy strip is basically the same idea, but dilutions are prepared on the strip of paper, and you can put it directly on the agar plate, and you can see the inhibition zone in the agar plate. So the method that does not let you determine the minimal inhibitory concentration is called Kirby-Bauer disc dilution method. So remember our lab last week? You placed a tiny little circle with antibiotic in the center, and what you can expect, this circle starts oozing antibiotic into the agar, and that establishes a gradient around that circle, gradient of concentration. The concentration progressively decreases as you move away from the circle. So at some point the concentration becomes so low that it doesn't inhibit the growth of microorganisms, and you will see an inhibition zone, something like that. You see? By the size of inhibition zone, you can determine whether or not the microorganism is sensitive to your antibiotic. The bigger the inhibition zone, the more sensitive the microorganism. Okay, so advantage of Kirby-Bauer disc dilution is, you could observe last week, it's really fast and it's really easy. Does that make sense? Like you don't really, like you can have very, very basic training to do that. Am I clear? But no MIC. And the very, very last bit here is the idea of therapeutic index. I love this conversation. This kind of gives you some insights into how pharma development works. So what is therapeutic index, or CI? Every drug has a toxic dose. Does that make sense? Toxic dose is usually expressed as the median toxic dose, which means dose that induces certain toxicity in 50% of treated patients. Okay? So, median toxic dose. And every drug has an effective dose that produces a therapeutic effect in 50% of all treated patients, or ED50. So therapeutic index is the ratio between median toxic dose and median effective dose. Simple question, really simple question. When you have a drug, do you want a therapeutic index for this drug to be high or low? Yes. Do you want a therapeutic index in ideal world for a drug to be high or low? High. Can you explain why? Okay, it's a fraction, right? It's a fraction. This is a fraction. You want toxic dose to be high and effective dose to be low. Does that make sense? If you have a drug that, I don't know, you need to give you need to give a bottle of a drug to a patient to kill him, but one tiny little pill out of 100 in the bottle is enough to provide an effective dose. That's good, you know? The bigger the therapeutic index, the higher the therapeutic index, the better. The more wiggle room you have between effective dose and toxic dose. Does that make sense? Good? Clear? Any questions on this?